Welcome, everyone. Stand by for Health Director Gibbie Harris. Gibbie, if you would.
Good afternoon, everyone. Thank you for joining us this afternoon. I have with me Dr. Meg Sullivan. We'll give a brief update on where we are in the county, and then we will be happy to take questions. And I apologize for the sirens. So just a brief update on our data. Our cases, we're at 90,766 cases, 816 deaths, and 68 outbreaks and clusters. The good news is that our numbers and our rates continue to drop slowly. Our positivity rate is at 10% over the past 7 days. That's great news, but I still want to remind people that those are rates that are similar to what we saw in November before the holidays. So those numbers were already high at that point. We still have work to do. Many probably heard the governor's announcement this afternoon. We have been focused on groups 1 and 2 for vaccinations over the last almost month and a half, I guess. Starting on February 24th, we will be focusing on K through 12 teachers and others that work in the school setting, as well as child care workers and those working in child care settings. For at least 2 weeks, they will be part of our groups that we will be focusing on. We will continue to focus on groups 1 and 2 as we have not completed vaccination of those groups in Mecklenburg County at this point. And then the governor's plan is to open up the rest of group 3 on March 10th. I want to reemphasize the fact that this is great news, but it's also very challenging for us who are providing vaccines because the amount of vaccine available to us is still very limited. We will be working with our vaccine partners to figure out the best way to get vaccine out to these populations and to make sure that we're continuing to vaccinate those in the first 2 groups who have not accessed vaccine yet. I want to emphasize the fact that although we have already given out about 79,000 doses in Mecklenburg County, first doses, that's only 7% of our population. We are pleased that there are some federal efforts to increase the amount of vaccine available in our community. They continue to increase amounts of vaccine available at the state level on small amounts on an almost weekly basis, and that we hope will continue to increase our allocation in Mecklenburg County. There's a federal program that includes Walgreens. Some Walgreens in the state will be providing vaccines starting on the 13th. I want to let people know that they are sticking to the groups that the federal government has put out there. The state government has put out there for us to prioritize. And they are getting small amounts of vaccine. As we understand it, they'll only be getting about 100 doses a week. But that's an improvement. Every little bit helps. And then there's a federal program that will focus on providing vaccine to our federally qualified health centers. That will be phased in over time, and we do not know yet when the 2 centers that we have in Mecklenburg County will access vaccine that way. The last thing that I wanted to speak to is just reinforcing again the 3 W's that we have been reinforcing for quite some time now. And for us, that includes avoiding gatherings. All of these things are spelled out in the governor's order, spelled out in the secretary's directive at the state level and at the public health directive here locally. There was a good bit of evidence of large gatherings over the weekend, some related to the Super Bowl, some not. Unfortunately, many of those folks did not have masks on, and there was very little social distancing. I want to reemphasize that these individuals should be quarantining themselves this week, not exposing themselves to others, and getting tested after 5 days of exposure. So we continue to remind people that we have lots of virus in our community. There is every opportunity for you to be exposed when you go out of your home. If it's not necessary, please do not do that and avoid these gatherings. It really does put you at risk, which then puts the others that you love and that you're around at risk. With that, I will turn it over to Dr. Sullivan to give us more of an update on vaccines.
Thank you, Gibbie, and good afternoon, everyone. So as Gibbie said, I'm going to just provide some additional information about vaccines. So first, again, from some quick data, we have administered here at Mecklenburg County Public Health over 22,000 first and second doses of vaccines. And again, as Gibbie mentioned, we continue to vaccinate individuals in groups 1 and groups 2 as per current North Carolina Department of Health and Human Services prioritization guidance through a combination of appointments at our Bojangles and Medic sites, as well as off-site locations throughout the community. We had a very busy week last week that included a very successful event at the Hindu Center with many of our refugee and immigrant community partners. And as of Monday, we'd administered all of the first doses of the vaccine we received the week before and have again begun another very busy vaccine week. This week, we will again be receiving 2,925 doses of the Pfizer vaccine and 600 doses of the Moderna vaccine. And our vaccine distribution plans include ensuring specific appointments prioritized for our vulnerable populations at our fixed locations, returning to multiple long-term care facilities for second doses, visiting additional in-Livion locations to vaccinate residents ages 65 and older, providing vaccines at a substance use treatment center and HUD-PUD and housing locations, and working with our Parks and Rec and DSS departments to hold an event at one of the Parks and Rec senior centers, and holding vaccine events at a Camino Center and one of our community churches this weekend. Again, it's going to be another busy week as we continue to work to distribute vaccine in accordance with our vaccine equity plan. And I don't think I can highlight enough how hard public staff and all of our partners have been working on vaccine response. In addition, I wanted to highlight 2 key notes for this week. First, based on anticipated vaccine supply we will be receiving, we will be opening up some additional appointment slots for individuals for the week of February 22nd and the first 2 weeks of March. These appointments will be available online using a link found on our website at mecnc.gov/COVID-19 and via phone by calling our hotline at 980-314-9400, option 3 for English and option 8 for Spanish. These appointments will be made available beginning at 8:30 a.m. on Friday, February 11th. This timeframe allows us to ensure we are able to disseminate information through our community partners and networks regarding this appointment availability. And it's really important to note that hotline staff will not be able to schedule anyone for these new appointment slots prior to 8:30 a.m. on Friday, February 11th. We continue to significantly upstaff our hotline to be able to be as responsive to calls, emails, and voicemails as possible, but also anticipate that these limited number of appointments may fill quickly. We really appreciate everyone's patience and understanding as vaccine supply remains limited. And again, we are working hard to distribute it as quickly and equitably as possible. Also, anticipating that these new vaccine appointment slots will fill quickly. Also on Friday, we will be releasing a new wait list option that will allow individuals who are unable to make an appointment the opportunity to submit information for Mecklenburg County Public Health to be able to contact them when appointments become available based on vaccine supply and appointment eligibility criteria. The wait list will be accessible from our appointment scheduling website and will be linked to our COVID-19 vaccine website. We are working to make the website available in both English and Spanish, and our hotline staff will be able to add individuals to the waitlist via phone in multiple languages. And finally, I just want to note that we continue to closely monitor the data and review process for potential emergency use authorization of new vaccines, including specifically the Johnson & Johnson vaccine, as well as closely monitor the emerging data regarding the effectiveness of the vaccine on the multiple new strains of COVID-19 that have been identified here in the country. At this time, based on available data, the Pfizer and Moderna vaccines still seem to be effective against the current strains, and most, if not all of the vaccines are effective at preventing severe disease, hospitalization, and death. And so therefore, we know that efficient and equitable vaccine distribution is such a critical tool to fighting this pandemic, and we continue to encourage everyone who is eligible to be vaccinated. However, as we also repeatedly say, we know at this time, what we really need to continue to do is do everything possible to prevent further spread of any strain in our community by doing those things that we know work. And as Gibbie said, wearing a mask correctly and consistently at all times in public, social distancing, washing our hands and surfaces, avoiding gatherings, staying home, and getting tested if exposed or sick, and then getting vaccinated when it's your turn. Thank you.
Thank you, Dr. Sullivan. First question today is Brett Jensen, WBT Radio.
Thanks, and like Gibbie, I want to apologize for the sirens in the background. In terms of Gibbie, 2 quick questions. I don't know if it's you or Dr. Sullivan that would answer the first one. In terms of Wake County, reporters asked Governor Cooper about percentages of people that have gotten it in Wake County, saying that basically 45% of their residents 65 and older have gotten it, and they were wondering why it had started for February 24th. When do you know what percentage of people 65 and older in Mecklenburg County have actually gotten the vaccine yet?
Thank you for that question. The first thing I'm going to do is ask Dr. Sullivan to confirm when the appointments are going to be available. Is it Thursday the 11th or Friday the 12th?
I apologize. Friday the 12th.
Okay.
Sorry. Thank you for, yes.
Just confirming that.
In a week. Yes.
Yeah, it has been a week. And I at this point, I'm going to also ask, I don't have the specific data on the percent of 65 and up that have been vaccinated. We do know that I think 65 or almost 65% of the vaccines that we have been given to administer have gone to 65 and up. But I'm not sure, Meg, do you know the number of 65 and up that we've actually administered to? I mean, the other issue is the data that the state has does not include the federal efforts that have been made through CVS and Walgreens in our long-term care facilities. So we don't have access to that data. So the only thing that we'd be able to report on are the ones that are happening within our department and our vaccine partners. So we can work on trying to get that number, but that will not give us a true picture because it doesn't include that other data.
And real quick, the other question I was wanting to ask, I think it was last week that you said that when someone asked you about, people getting at the front of the line in group 3, and you said, you know what, everyone wants to get at the front of the line in group 3. That's just human nature, I guess. So what were your initial thoughts about teachers getting it ahead of other people, other frontline workers?
I'm not sure what to say about that, to be perfectly honest. I think all of the frontline workers who are engaging with individuals in our community and providing services to them are important. I'm assuming the state has specific reasons for making the decision to start with teachers and childcare workers. And as always, we have been consistent in working through the state's guidelines, and we'll continue to do that this time. I would find it extremely difficult to prioritize any one group over another.
Next question is Ken Lemon, WSOC TV.
Hi, Gibbie. This question is in relation to the groups of individuals, Super Bowl partiers, people partying over the weekend. Couple of questions. One, there was some thought that maybe this might lead to a second surge. And number two, is there any effort going on a county level by the health department to identify these individuals, to identify the entities, restaurants, or other individuals who may have sponsored that event, and to hold them accountable?
So the ones that we know of, and we've been provided with a number of videos as well as information about events and gatherings that included people who were not socially distancing, not masking, and in large groups. We are doing our follow-up with our community, our COVID ambassadors to those organizations, to those restaurants, bars, businesses, to have conversations with them about the behavior that was observed over the weekend. We really do not need that kind of behavior to continue. We've also been having conversations with our law enforcement partners that we work with on this as well. Obviously, they're the ones that would need to enforce, and so we are working with them around whether there's need or intent to enforce. We are not trying to track down individuals who are at these settings. There's really no way for us to do this. That's why we're speaking out right now to say that if you were involved in any of those settings, you need to be quarantining. You need to be staying away from other people, and you need to be tested within 5 days of the event so that you can determine whether you've been infected, and then if you have, to isolate. That's the only way to know for sure whether you picked up COVID during that experience that you had over the weekend.
Next question is Reuben Jones, Spectrum News.
Hi, Gibbie and Dr. Sullivan. I want to follow up on something the governor touched on earlier a little bit, and regarding whether someone will need to show an ID when getting that vaccine. It sounded like some of that is going to fall a little bit to the specific provider. So what is the procedure when someone comes to get that vaccine in group 3, and what's stopping somebody from saying, yeah, I was a teacher, but actually they were, doing Teach for America 20 years ago, and now they work in banking?
That's a great question, and it's a difficult one. We can spend our time getting the vaccine out as quickly as we can, or we can spend all of our time policing this. We are asking the right questions. Our staff actually is pretty good at recognizing when somebody's skirting the issue, and do not hesitate if they do not believe this person is eligible to question it more heavily. So we will do our best to make sure that the people that are accessing this vaccine are the ones that are actually eligible for the vaccine. But at the same time, we want our community to be honest with us. We want individuals in our community to understand why some individuals have been prioritized over others for the vaccine, and to try to honor that. We also want everyone to know that we're working as hard as we can to get through these groups so that everybody has vaccine as soon as the vaccine is available. So we will trust our community in as much as we can, and we'll also attempt to verify when it's appropriate to make sure that the individuals that are coming through for vaccine are the ones that are actually eligible for it.
Next question, Steve Harrison, WFAE.
Yeah, Gibbie, thank you. I'm asking this from my colleague, Ann, from the school board meeting last night. And apparently, board member Jennifer De La Hara is asking you guys to kind of expand your contact tracing, regardless of whether the kids are in person or remote. And she's also looking for a breakdown by CMS, charter, private, homeschool, et cetera. Have you guys gotten this request from CMS, and is that something you can do?
We have not gotten that request yet. And what I can tell you is that we will provide the information necessary to protect the individuals in the school setting. That is what public health does. We are not policing all of the individuals in our community to provide data that would make, I'm not sure why the data is necessary, I guess is the bottom line. If these individuals are remote, they're not in the school setting, I'm not sure why that information is useful. What we want to do, make sure is that if there are individuals in the school setting who test positive, that we're following up with them and that we're doing the contact tracing with the individuals that may have been exposed to them. That's what's important right now, and that's what we're going to stay focused on.
Next question is Hunter Saenz, WCNC.
First off, do we know roughly how many child care workers and educators there are in the county? And then second, I think you touched on it earlier, but what do you say to those other frontline workers who are now put on the back burner in phase 3 when we know that the data that you have talked about shows that schools are safer than some other institutions and places of work?
So we have been working with our partners to gather numbers for some of the groups. I don't have that specific number around child care providers available unless Dr. Sullivan does. In terms of the other folks that are in group 3, all we can ask at this point is for them to be patient just a little bit longer. They've been patient up to this point. As I've said, the governor plans to open the rest of group 3 on March 10th. So we're looking at a couple extra weeks. I know that's frustrating for many. And as I mentioned earlier, it is really difficult to prioritize one subgroup within group 3 over another. They're all important. They've all been providing service in our community, many of them since March. And we want to make sure that we can get them vaccinated as quickly as we can. Meg, do you have that number?
We have an estimate using, I think it was the Bureau of Labor Statistics, around 1,500, but we also know the state released a deeper dive about who is included in that definition, and so I don't know if that number includes everyone in that definition.
Next question is Alison Kuznitz, Charlotte Observer.
Hey, Gibbie, it's Alison from the Charlotte Observer. Could you talk about, as far as those restaurants and bars, are they the main source of COVID transmission right now in our county, or what are the main sources of where COVID is spreading right now based on contact tracing efforts?
Based on our contact tracing efforts, what we're seeing is, there's exposure across the board. We're seeing it in restaurants and bars. We're seeing it in schools. We're seeing it in sports. We're seeing it in individuals who have gone to work. We're seeing it in places where people are gathering. So it's across the board. I think the bottom line, again, is that we have enough virus in our community still that anytime you are out in the community away from the people that you live with, you're potentially exposed. I don't know that we have information that shows that those restaurants and bars are at a higher level of exposure. But part of that is based on whether those individuals share that information with us or not. And that's not always the case. So we continue to try to assess that. But again, I think what we're seeing is widespread exposure in any type of setting where people come together.
Next question is Lana Harris, WCNC.
Hi there, thank you for this. So I'm not sure if you've seen, but there is a petition that has about 1,000 signatures now to turn the lights at county tennis courts back on. I believe it was your directive that extended that kept the lights off after dusk. And players I've spoken to, I know you've heard this, says it seems confusing. They are safe to play in the daytime, but not at night. And that lights for private fields for tennis and other sports have been on past dusk, and people are saying it's only crowding the courts more during the daytime hours. So, my question is, why are those lights turned off for the county's tennis courts, and why is that still necessary? And do you still plan to continue that through February 28th? Thanks.
That is a good question, but it's not necessarily one for me to answer. The decision was a county level position. We made our recommendations through the directive that was provided that would limit people's exposure outside of their homes. And the county decided that included keeping those lights off on all courts in all fields in county that belong to the county. So that was a county level decision. And as far as my last conversation with the county manager and with the Park and Rec director, that will continue through the end of February.
Next question, Hannah Smoot, Charlotte Observer.
Hi, this is a question for Dr. Sullivan. Those new appointments that you said will become available, if somebody is an educator who will be newly eligible for a shot and they're signing up for an appointment, after that February 24th date, can they go ahead and sign up for those appointments starting on Friday, or do they need to wait?
Yeah, I think it's a great question. I will say that we've had this plan in place prior to the governor making this announcement. And so we often talk about rapidly evolving situation. But at this time, so again, as Gibbie mentioned, we are following North Carolina Department of Health and Human Services guidance. We are still very focused on groups 1 and groups 2, and we'll be doing everything possible to make as much vaccine available to those individuals who have not yet been vaccinated. But beginning on February 24th, individuals in groups who fit that criteria, so our early childhood and K through 12 educators, will be eligible to make an appointment, yes. Not before February 24th, though.
So, but they can, when we open appointments, they can go ahead and sign up for those dates, starting on the 24th. So when those appointments open up on Friday, they can go ahead and seek an appointment starting on the 24th.
Next question is Eric Spanberg, Charlotte Business Journal.
Hey, Gibbie, this is Eric Spanberg with the Business Journal. I'm just curious, you had a couple of questions about the Super Bowl and trying to deal with both citizens and businesses. It seems like throughout this pandemic, it's Independence Day, it's Labor Day, it's Mother's Day. There's always something. And I'm just wondering whether you feel like there's any way to kind of break through to people that they've got to skip some of these events. And then Secondly, are you worried about a false sense of security because the numbers are starting to come down a bit?
Oh boy, both great questions. We have continued to try to get the message out that this is an exceptional year for everybody who's living through it. And because it's an exceptional year, we are asking people to make exceptions to the way they celebrate holidays, to the way they celebrate events. It's just not safe for us to do the things that we normally like to do on holidays, on events, on Super Bowl, on whatever it happens to be. And so we continue to try to get that message out to people that this is a year of exception and they really need to think of different ways to celebrate so that they're not exposing themselves and exposing others to the virus. And we'll just continue to try to drive that message. And remind me the second half of your question, please.
The false sense of security because some of the trends have improved.
Yeah, and that is a major concern. Our numbers are coming down. They are improving. They are still very high in our community. I mean, those if you look at the graphs, we're looking at higher numbers than we had in July still. And July was the last peak that we dealt with. So we're still above that peak that we saw in the summer. So we do know that that people are feeling like things need to open up because those numbers are improving. And I think what I'm asking of folks is to stay the course. We really can't back off now and start thinking that everything's okay. There's also out there these days, and who knows what's going to happen. Everything about this virus has been unpredictable. But we do know that we have variants in our community. We know that they tend to be more contagious. And there are some predictions in this country that we are going to see another spike because of that. And the way to avoid that is for people to do the things that we're asking them to do. We don't have enough vaccine out in our community yet. We're thinking we need 65 to 80%, 85% vaccinated to really get to a place where we're more comfortable that people can be out and about in the community. We're at 7%. We've got a long way to go. So we really need people to continue to wear masks, socially distance, avoid gatherings, stay at home if you can for a while longer. I know it's been a long year, but we still need to maintain that behavior if we're gonna get through this more quickly.
Next question is Kristi O'Connor, WBTV.
Hi, Gibbie. With so many people who are 65 and older still struggling to get appointments, and then with group 3 coming soon, how do you ensure that they don't get skipped over, those 65 and older? Or do you have any advice for them in scheduling an appointment, especially with this new round of people that will also be booking appointments?
That's a great question as well. One of the things we're hoping for is more vaccine. If we have more vaccine, we can make more appointments available. But the other thing that we continue to do, and we know that our other vaccine partners are doing the same thing, is holding events that will be more available for the 65 and older, and looking for ways to make sure that there's equity in how we're getting the vaccine out so that we can continue to work through that group and get them vaccinated. So we're looking for specific ways to do that, as we're also opening up for group 3, as the governor has asked us to.
Floor is now open.
Just to add also, we talked about signing up. If the appointments do become full, signing up for the wait list. That's something that we take very seriously, and will again be prioritizing individuals. And so that will be a new function again available on Friday, February 12th at 8:30 a.m.
Floor is now open for follow-up questions.
I have one on my tennis question. I just want to make sure I was clarifying. You said the tennis court light situation was a county-made decision based on the directive. You mean the directive from Health Secretary Mandy Cohen?
I didn't catch the last part of your question.
Did you mean the directive? You said it was the county made the decision based on the directive. I just want to make sure, is that a CDC directive? Was that Mandy Cohen's directive? What were you guys following with that?
It's basically the public health directive we have for Mecklenburg County, but that directive is consistent with the Secretary's directive as well.
Okay, thanks.
Dr. Sullivan, I have a quick follow-up on that 1,500 number that you gave as an estimate. I'm assuming that's child care workers, not teachers. Do we have a number of, say, teachers who we could expect getting vaccinated in this county alone?
Yeah, so thank you for clarifying. Yeah, so the 1,500 again was a specific estimate of childcare workers, and that we do imagine is a little bit of an underestimate as we apply that definition. For the numbers that we have right now, from the numbers we've been provided from CMS, is about 20,000 individuals. And then we are also working right now directly with our non-CMS schools, or our private charter and independent schools, to get that estimate as well. And we'll provide that when we have it available.
Thank you so much.
Mm-hmm.
So Meg, just to clarify, is that 20,000 teachers? That does not include school staff who are also eligible.
The 20,000 is staff. The 16,000. So that does include.
Okay,
yes.
Thank you. Just wanted to clarify.
Gibbie, this is Brett again. I'm curious, when you spoke to Mecklenburg County, CMS, because I know I asked you about this last week and you had yet to speak to them. When you spoke to them, did you recommend to going to school more, once the governor opens it up, Group A and everything else? Did you, or will you recommend the kids going to school much more than they are now on the part-time basis?
At this point, I agree with the process that they're implementing, is to start slowly, to get the kids back into the classroom, at least for part of the week. And let's see how that goes over the next couple of weeks before they consider moving into more days in the school setting for the children. So, one of the things that we've been challenged with as we've moved through this is when we've seen improvements, we've opened things up, and we've opened them up pretty radically, and that hasn't always worked well. So I like the idea that they are moving slowly and judiciously as they get children back into school.
This is Kristi O'Connor again. My apologies if you already said this, but have you said how many appointments will become available on Friday?
So we are planning on opening up, again, only a limited number. This is based on anticipated vaccine supply, but still gives us the ability to do community events as well as allow for some prioritized appointments. And so we will be opening up around 1,200 or so a week, somewhere between 1,200 and 1,500 a week, again, giving us flexibility to increase that as we learn more about vaccine supply.
And I just want to clarify too, those are the ones that the health department has available. Both healthcare systems may have additional appointments as well. We don't know at this point.
Any further questions?
Yeah, this is Brett again. I'm sorry. Real quick, in terms of from Dr. Sullivan and Gibbie, just overall, once this whole vaccine thing started on December 14th, I think that was the date when we got them here in Mecklenburg County. How would you rate how smoothly things have gone on a scale of 1 to 10, like 5, 10? Like, how would you guys rate of giving out the vaccine has gone?
I don't know what Meg will say, but I'd say it depends on the day of the week. Some days it goes very, very well. I mean, I think the process that we've been able to develop with what we've done within the health department has worked extremely well, and we're being pleased with the events that we're having in the community right now. And both of our healthcare systems have stepped up and provided vaccine both in their sites as well as in the community, and that's gone well as well. And the important thing is that we're getting the vaccine out, and it's going out as quickly as we're getting it in. We actually have had a little bit of a snafu this week because the CDC made a mistake in the order that the state placed. So we're actually going to be late getting our vaccine this week, and we're running up against the possibility that we might run out. But we've been able to manage through that. But, every week is a little different based on issues like that. So the fact that our staff has been able to roll with the punches and really get the vaccine out as quickly as we get it in. I think it's gone as smoothly as it could.
Last question, please. Any further questions?